Your eye doctor isn't just checking your vision, they might be the first to spot serious health issues. So, what do they actually see when they look into your eyes? And what do you need to be doing to protect your vision? Today, we're breaking it all down with an expert who's been helping patients not just see better, but live healthier lives through better eye care. Dr. Donahue is an optometrist who grew up surrounded by eye care. Her family built a concierge style practice long before that was a thing, and she's continued that mission in her own boutique eye care practice. She's here today to help us understand what our eye exams are actually telling us and to share what we should all be doing to protect our vision. Dr. Donahue, welcome to the show.
Dr. Bio, thank you so much for having me. I am thrilled to be here and to talk about this important topic with you.
We are excited to have you part of the show. First, what I'd love to do is start out with some fun rapid fire questions. We're going to talk about eye health and also about you. The first one is, can eyes really change color over time?
They can, depending on the pigmentation. So you think about an infant, and that's where you see it the most prevalent, is that a lot of infants are born with a lighter color eye. And as they age and grow, they start to accumulate more melanin, and that contributes to the pigment that ends up to your final eye color. There are some different things as you age. Certain medications sometimes or eye drops can alter eye color and things like that. But most of the time, it's going to be as you're growing and accumulating that more melanin pigment is going to alter things.
A lot of times with new parents, they come in, they'll ask me, is this the standard eye color? Is there something else? Or it changed. So this really allows people to kind of have that information in advance. Okay, next question. Glasses or contacts? Which do you personally wear?
Both. I always tell people you need different things for different activities for your eyes. And we live in Reno, Nevada, beautiful hiking, skiing. And I say, do you wear the same pair of shoes when you go on a hike as when you do when you go out to dinner or when you go into the office? 9.9 times out of 10, the answer is no. It's the same thing with your eyewear, contacts, etc. You really have to, you tailor it to your lifestyle. So it depends on if I'm out skiing, I'm going to have my contacts on. If I'm in front of the computer, I'm probably going to have a computer pair of glasses on. So you really just have to tailor it to what activities you're doing and how you're utilizing your eyes.
It is the wardrobe for your eyes based on the event. Love that. Biggest myth about vision you wish people would stop believing.
Ooh, eat carrots and I won't need glasses.
There's a lot of parents out there who are using that as their
Yep. I would rather tell them to go get a bag of spinach, greens. Carrots are wonderful. I'm not downplaying carrots; they're great. But there's a lot more to it than that.
I love that. As a parent myself, good to know. Okay, do we actually stop blinking when using screens?
No, but decrease in the blink rate, absolutely. And that is one of the big reasons why people today are suffering from so many ocular issues and discomfort and dryness and stinging anytime we're using these screens or reading a lot. It's a very similar physiologic process, is that we don't blink as much as just in normal conversation when we are engrossed in something that is right in front of us that we're really paying attention to, but the screens are tough.
Great insight. I never thought about that. Next one. What's your number one eye care tip that most people ignore?
This is a tough one. I have a few because I like to incorporate the whole system and not just look at the eyes. I'm going to have to say it's a whole systemic health issue. It's very difficult to separate the eyes independently because they are linked to so many different things. Is take care of your systemic health and you're on the right track to good eye health.
Thank you for playing along. I think it's really interesting how we were able to talk about a couple of things that we're going to do a deeper dive into, as well as break a couple of those myths. Okay, so let's start with this. What's the biggest misconception people have about their eye health?
That if you don't wear glasses, you don't need an eye exam. So there is a very big difference between vision and having good vision and your ocular health. They are two separate things. And getting an eye exam, just the people that require glasses are not the only people that need yearly eye exams.
And that is a huge misconception where I've even heard patients when they come in for, let's say, their wellness checkup, and I'll ask, have you had your eye exam this year? Well, I don't wear glasses. And that is a common thing. And I'm glad that we're talking about it because people think, oh, I need to update my glasses or I have to have an issue. But we don't want you to have an issue. As doctors, we want to prevent that. What are some of the assumptions that people think are wrong with their eyes when they come in and see you?
Well, it can go two ways. Sometimes, and we see this a lot with kids, that they think, parents are finally bringing them in at, 12, 13, 14 years old, and they think things are fine. And then we get through the exam and they realize that their child can't see hardly at all. It's heartbreaking. And I've had parents literally so upset, they're almost in tears. It's devastating because if the teachers aren't picking up on it, which, let's be honest, there's a lot going on in those classrooms. It's impossible for them to be able to worry about, which kids are squinting, which kids, can't seem to see the board. It's rare that that happens. When the kids don't know any better and they think that that vision is normal, how are they going to go to their parents and say, Mom, Dad, I can't see this? So that's one of the most heartbreaking things is you have to get your kids in early. Now, when they get older, when they get to be a teenager, they have the common sense to probably tell you that they're not seeing very well, but it's those younger elementary grades that we see it the most, that they think it's normal to be blurry. So that's one of the biggest things. I would say the other thing is there's a lot of ocular conditions that don't necessarily lead to discomfort or pain, but can cause devastating sight loss. But just a general assessment with dilation is just critical every year for everybody.
I've had patients who have presented, kiddos who have come in and they've had these chronic stomach pain or headaches. And we do all the tests just to make sure that it isn't something else. And we find out there's an issue maybe with friends or with classroom behavioral issue that actually stem from bullying or other factors. Well, imagine if your child is maybe acting out or struggling with something because they can't see. And that's their only way to kind of pivot. The other thing that I think it's important that you mentioned is as parents, yes, we are there to take care of them and help our kiddos live the best life. But how you can do that is role playing that you should get your eyes checked out. You should get your heart checked out. All of the things that are essential to living the best life starts when they're small. As you mentioned, in teenagers, we hope that they'll say something, but if you can plant that seed from the beginning, wow. When we talk about glaucoma, there's multiple eye diseases, but we'll start there. It's often called the silent thief of sight. What is glaucoma and why should we be concerned about it?
Let's first discuss what glaucoma is. And it is a very broad term encompassing several different diseases that ultimately all cause damage to the optic nerve. And if we go back and review the anatomy, the optic nerve it serves as that cable that connects the back of the eye to the brain. And it carries visual information to the back of the brain, to the visual cortex. And the visual cortex in our brain interprets those signals and tells us what we're seeing. We're looking at a house, we're looking at a mailbox. So when damage occurs to the structure, it leads to peripheral vision loss. Unfortunately, glaucoma is one of the leading causes of irreversible vision loss in the world and in the US. There was a study from JAMA Ophthalmology that reported in 2022 approximately 4.2 million Americans have this disease. And it is referred to as the silent thief of sight because unfortunately, as it progresses, it's very slow and it's painless. A patient could have glaucoma for years or decades, and if they're not getting screened or checked, it can progressively be taking away parts of their peripheral vision, but it's so slow, they never know until it's end stage and it's absolutely sight-threatening. Sadly, there's no cure for it. The power's in the screening and the power is in early detection, so you can get on some type of therapy. There are different types of therapies that slow down the progression, and the whole goal is to catch it as early as possible to prevent some of that damage. And so hopefully the patient can kind of outlive it and not be truly affected by the vision loss.
I often see people come in and they're like, oh, yeah, I'm getting older. And I think that's why I'm not able to see as well. And they attribute this vision loss or vision changes to getting older, to stress, to other things. Have you had any stories like that where patients have come in? I mean, when we talk about glaucoma, like you mentioned, it's a silent disease and people just may not even notice or they can associate it with something else.
Exactly. Yeah. They think that it might be other conditions like cataracts, or which we know we all get as we age. It's kind of like getting gray hair. It's a fact of life. It's going to happen if we're lucky enough to be on this earth long enough. Unfortunately, when these stories occur, they're usually pretty end stage with the damage. It does happen, and it's going to happen more in inner cities. There is definitely a disparity with catching the disease, I think. Glaucoma is going to occur about 6.5 times more in African Americans than it does in white people. There is some part of genetics that attributes to that, but there's just so many times that people just don't have access to care, and all of a sudden things go down the road and progress, and they don't get checked for years and decades, and then they wonder why they're not seeing well. And it's just devastating when this is the outcome, and we have to tell them there is no cure for the vision that they've lost already.
What would you say to somebody who is wondering, I might have this? I've never had my eyes checked out. What can I do to access care, especially if I may not have the resources right now to be able to do that kind of traditional check in? What can they do?
So my first recommendation would be, actually, a lot of insurance companies, even if you have some type of state funded care, a lot of times they will cover a medical eye exam. Now, there's a very different, medical eye exams are a lot more than just which is better, one or two. The whole glasses component is important, but a lot of insurance companies will allow patients to come in for the medical part, and that is essential. So the first step is, if you do have some type of medical coverage, see what it covers, because a lot of times you can go in for an eye exam. They may not cover glasses, but at least you're getting the health aspect taken care of. If you don't have any type of coverage, the National Institute of Health has an incredible resource for all these different programs that can help patients. I have listed some of them. There are a lot of ophthalmologists who will donate care. VSP Eyes for Hope is one of such programs for qualifying people of any age. A lot of times there's even mobile outreach clinics that may be in bigger metropolitan areas that can help patients. There's an incredible program through the American Academy of Ophthalmology called Eye Care America. It is one of the US's biggest leading service organizations for ophthalmology. And all these ophthalmologists are on a volunteer basis, and they are providing medical care to eligible seniors over 65 with often no out-of-pocket cost. There are different resources for surgery, because sometimes the glaucoma is so advanced, people need some surgical intervention, or just even general cataract care that patients may require as they get older, but may not be able to afford it. There's Operation Sight and Mission Cataract USA. There are resources out there, and the National Institute of Health has a wonderful website with all these different options listed for patients that can check into obtaining the care that they need.
These are all great resources. And the ones that you shared, some I hadn't even heard of. And I want to elevate what you mentioned, that a medical eye exam is available. Like, even if you don't need glasses, this is something that you can ask your insurance company for. And if you don't have insurance, still look at the NIH or other organizations that can help you. Here's a crazy cool thing about our bodies. Your eyes can reveal hidden health secrets that most people never see coming. What surprising health concerns can you actually identify through a simple eye exam that are not typically associated with the eyes?
Actually, a lot. So you think about it, your eyes are truly the window to your systemic health. When we are looking through a dilated eye exam at the blood vessels in the retina, this is the only place in the body where we can actually visualize vasculature without invasive measures. When we are looking at the dilated exam, whatever's going on within that retinal tissue and with the blood vessels within the retina, that is a really good indication of systemically how things are looking elsewhere. The biggest thing is that optic nerve, that cable that we talked about that connects the eye to the brain. So we have a direct connection to your brain through the eye. So we're able to pick up on a lot of neurological conditions such as brain tumors, multiple sclerosis, strokes. We can pick up on autoimmune conditions like lupus, thyroid disease, myasthenia gravis, sarcoids, sickle cell. There are so many things. And the biggest heavy hitters that we see every day are going to be diabetes, high blood pressure, and high cholesterol. There are so many times we can flip this conversation because those folks who rely on glasses to see all day long, they don't miss their eye exams. They're the ones that come in every year, but they may not get their physicals with their doctor every year. There are so many times that I can't even count that we have picked up on diabetes or a patient having very scary levels of high cholesterol or their blood pressure's out of control. And I ask them, gee, when was the last time you saw your doctor? Or have you had your blood sugar checked recently? Do you know what your blood pressure is? And they have no idea. Oh, I haven't had a physical in at least 5 years. I haven't had blood work in I don't know how long. It does go both ways, but we can see so much that there's a lot more than an eye exam than just getting new glasses.
It is an opportunity to live longer. It's an opportunity to know more about your health and do something about it. Those are wins that you can gain by getting an eye exam. And we talked about how to navigate it. We talked about the cost, and you shared great resources that people can actually utilize if they're having issues with their insurance. Now, I would love for you to share when someone goes in and they see their eye doctor, what are some of the questions that they can lead with, especially if they're concerned about glaucoma or any other eye disease?
So when patients come in for their exams, they should be requesting a dilated eye exam. I hope that it happens organically, that they don't have to request it. But I have to be honest, today's medicine is fast and furious. A lot of it is based on how many patients can we get through. If everything looks okay, we don't need to dilate you today. It is sadly a reality of what's going on in the nation right now with healthcare in general. But the biggest thing is you want to be dilated. I know it's a pain in the butt. I know it makes things blurry for a few hours. Nobody particularly enjoys it, but it's critical. The dilation is where we can pick up on a lot of those health abnormalities, especially the biggest ones, diabetes, high blood pressure. If you can, ask to obtain retinal imaging as well. Now, this is one, unfortunately, that insurance companies typically are not going to cover unless if there is a problem. If you can afford the extra fees to do it, I recommend doing it. And I recommend doing the dilation as well, because the dilation allows the physical doctor to see and document what is going on with your ocular health, but it is very subjective. And when you compare it with the retinal imaging, if you're able to, that is an objective photograph. So you can refer to that year after year to really monitor for change. The other thing is know your history. If you have diabetes, what are your numbers? What are your blood sugars? Do you check them every day? What was your last A1C? If you have high blood pressure, where are you at? Where are you skyrocketing a couple times a month? And know your family history. So you have to ask those questions to your family if you're able to. Has anyone lost sight? Has anyone had trouble with their vision that's caused them to lose vision? All those things are very important because we know genetics, they can be a blessing and be a curse. So the more information you have going in about your health and your family's health, the better off you're going to be.
Utilizing specific language. I'm having a hard time using the computer lately. I'm having a hard time even when I go out to eat, reading the menu. I think my uncle or cousin has diabetes. All of those are helpful for the doctor.
Absolutely. The more that you can tell your doctor about even your visual habits, how you're spending your days, how you're using your eyes, is just going to benefit you and allow the doctor to tailor the exam so you can get the most benefit.
I love that. Okay. Now I'm going to ask you to give us your best tips. What's something simple we can all do to take better care of our eyes?
Don't smoke. Number one, do not smoke. It is absolutely devastating to your whole entire body, but it ruins your whole vascular system. Your eyes are very, very susceptible to those types of changes, and it can lead and make the symptoms of macular degeneration worse, which is another absolutely sight-threatening disease that we haven't touched on too much, but it's just critical. It affects everything. That's the biggest one. And to go along with that is if you are diabetic, know your numbers because we can see it. You know, when you're out of control and if you've been out of control with your blood sugars for a long time, we're going to see it. It's very difficult for us to help a diabetic patient who doesn't know their blood sugars and they're clearly out of control. The best thing is prevention. And I know it's hard. And I don't envy anybody with that disease. It is a everyday thing that is devastating, but do your best to manage the systemic side of it, and it's going to benefit your eyes all day long. So that's the biggest. Wear sunglasses, no matter if it's cloudy or not, and make sure that if they're not prescription sunglasses, you can get them at the store. That's no problem. But look for that sticker that's going to be on the lens that says 100% UVA and UVB protection. If there's no sticker on there, I would not be buying those sunglasses. Stop sleeping in contacts. It's everybody's done it. I've done it. I'm not going to lie. It's going to cause a problem. And if you continue to sleep in them, corneal ulcers are no joke. I have had grown men sitting in my chair crying, their eyes out, can't even turn the lights on. They could walk in with a towel over their head because they're in so much pain. Please don't sleep in your contacts. And then the basic one for all of us, especially our kids these days that are on computers so much with school, that 20-20-20 rule. Every 20 minutes, take a 20-second break and look 20 feet away does help with the visual eye strain at that computer distance. Just give yourself a break. Look out the window. If you can get up from the screen and physically walk around, that's the best option. If you can't, just turn away, look out a window, down a hall. Anything helps. Just change that focal distance.
These are all fantastic tips. I want to break down some of the ones that you mentioned specifically. Smoking. We've all heard stop smoking, but let's go a little bit deeper. As you mentioned, it can be damaging to the eye. Why? The eye needs oxygen, blood to flow. And when you are smoking, it prevents that oxygen. And if you don't have that going into your eye, you're not able to see as well. And that chronic damage adds up. You mentioned diabetes. We know that's a silent disease. And if your sugars are elevated, you may not know. And you may just think, oh, it's a little bit blurry vision. So those are just two amazing things that people can do because there's a lot of things that are out of our control. But as you mentioned, if you know your numbers, if you do 20 minutes looking away, as well as making those choices of not smoking or all of those things can be really helpful. For parents listening, what things can they do to model eye health?
The biggest one is taking their kids to the eye doctor. And this is a big misconception. I love our pediatricians out there. I could never be one. I am so glad we have them. Their screenings are a great starting place, but they are just a screening. Every child around the age of 1 should be getting an exam with a pediatric ophthalmologist or a pediatric optometrist. There are certain things that can only be corrected up until this critical age of about 6-7 years old, that if they are missed, that child may never develop 20/20 or normal vision. That is why it's so important to actually have a full exam with a pediatric specialist in an infant stage. And going back to some of the programs that are out there, there's a wonderful one called Infant C. And Infant C will provide free exams for infants from 6 months to about a year old. There are lots of different practitioners that are associated with this, and it's just wonderful. As long as they're okay at that exam and you want to wait till about 5 when they're kind of in school age, that's great. But that first one around 1-ish is very important. The other things you can do is be a good example, just like everything else. It's what you eat, how you exercise. Are you going to get blood work done? Are you going to your doctors? And your kids see that. It's monkey see, monkey do.
And when I think of that lifeline that we can build upon in our own family of health, preventative health, that starts the journey. Before we wrap, let's hit 3 takeaways to keep in mind for eye health. Dr. Donahue, I want you to give me your top 3. I know it's hard because you've sprinkled in all of these amazing things.
It's hard, but the first one is, if you hadn't had an eye exam in the last year, go get one. Go schedule one for your family, for you. The second one, the best way to achieve good ocular health is addressing your systemic health. The last one, don't ignore vision changes. They could be subtle, but they really could be early warning signs. So if you are not seeing the way that you should, and especially if it has happened fairly quickly, get in to see somebody immediately.
These are all things that we can do. Things can sometimes feel like, oh, this is too much for me to do. Everything that you mentioned and these takeaways are things that we can actually do. Before we completely wrap, I just want to highlight, often we take our eyes for granted. And it isn't until something doesn't feel right that we are like, oh, we need to go in and be seen. Well, you have now been armed with new knowledge, new resources, new information that you might have had some misconceptions about. So, thank you, Dr. Donahue, for bringing us practical wisdom that we can use starting today. I appreciate you taking the time to help us see eye health in a whole new light.
It's my pleasure. It's been an honor to be on the podcast, and I'm glad just to share these insights that can start everybody on a better ocular health journey, just doing some simple things.
Well, tell us, how can we get a hold of you? How can we learn more from you? Where can listeners find more information?
You can find me on socials on Instagram at Envision Optics, NVISION OPTIX, and same thing for Facebook, Envision Optics. If you'd like our practice information, feel free to send us an email at info@envisionoptics.com.
I love it. Well, thank you for sharing so many insights that we can use right away to improve our overall health. And it does include our eye health. And that was one common thread that I loved hearing about. Did something in this episode click for you? Share it with someone who might need these insights too. Because here's the thing, real healthcare advocacy happens beyond clinical walls. It's about understanding our bodies, knowing our resources, and helping each other navigate the healthcare system. You've got this.